The NHS is standing on the precipice of a revolution, one that holds profound implications for the nation's elderly population. In February 2025, a series of sweeping GP rule changes are set to reshape the healthcare landscape, and the stakes couldn't be higher. For a generation of seniors who have long been underserved and overlooked by a fragmented, overstretched system, these reforms offer the chance for an improved and more personalized care experience. Yet, it is impossible to ignore the urgency and scope of this change. Seniors are not only facing increasing health complexities, but the NHS is under extraordinary strain. The introduction of these rule changes is essential, but they must deliver, or the very people who rely on the NHS will find themselves further abandoned. The centerpiece of the reform is a long overdue reintroduction of the family doctor model. Seniors, in particular, have been subjected to the chaos of having to see a different doctor each time, with no continuity of care and, often, no understanding of their long-term health journey. This new approach aims to reverse that. For older adults struggling with multiple health conditions, having a dedicated GP who knows them well could be transformative. This is not just about seeing the same face at appointments, it's about a doctor who understands the nuances of their medical history, can anticipate health challenges, and, ultimately, provide better outcomes. The promise of continuity is not just a nice-to-have, it's a game-changer for seniors, who, in many cases, require more intricate, time-consuming care. The increased efficiency that comes from one dedicated professional overseeing their medical landscape cannot be overstated. Furthermore, these changes will significantly cut down on the bureaucratic red tape that has long plagued the NHS. For too long, GPs have been bogged down by excessive administrative work, leaving them with little time to properly engage with their patients. This has been especially detrimental to the elderly, whose care often involves complicated medication regimens and management of several comorbidities. By slashing outdated performance targets and easing the burdens on administrative tasks, the NHS is finally acknowledging that time spent on paperwork is time taken away from patient care. This is a critical move to ensure that seniors receive the focused attention they need without being rushed out the door before they have a chance to fully explain their concerns. Of course, the reforms are not just about improving care, they are also about improving access. The elderly face tremendous barriers in reaching healthcare services, whether it's due to mobility issues, lack of transportation, or the frustrations of navigating an increasingly digital-first system. The NHS is taking these challenges head-on. The introduction of same-day phone consultations is a brilliant step forward, ensuring that seniors who can't attend appointments in person are not left to suffer in silence. It's not just a minor tweak, it's a fundamental shift that says, we are prioritizing you. In addition to these phone consultations, the NHS is introducing dedicated phone lines for emergency doctors, paramedics, and care homes to gain rapid GP advice, which will have a direct, immediate benefit for vulnerable seniors. Whether living at home or in care facilities, this is a major step toward a healthcare system that anticipates the needs of its aging population. But let's be clear, these changes are not merely cosmetic. They are vital to the long-term sustainability of the NHS, especially in a system that has been woefully ill-prepared for the aging population it must now serve. With an increasing number of seniors facing chronic conditions, it is imperative that healthcare becomes less reactive and more preventative. The reforms will incentivize GPS to address conditions like diabetes, hypertension, and heart disease much earlier, catching them before they lead to serious complications. This is a crucial move that could ultimately reduce hospital admissions and alleviate the immense pressure on emergency services. If the NHS is to cope with an aging population, prevention is not optional, it's essential. It's not just about fixing the immediate problem, it's about investing in a healthier future for the elderly, allowing them to live longer, more active lives while simultaneously reducing the burden on a strained system. Mental health has long been the overlooked cousin of physical health in the UK, particularly when it comes to seniors. This is yet another area where the NHS reforms are addressing a glaring deficiency. For years, depression, anxiety, and isolation have been rampant among older adults, often ignored in favor of more visible physical conditions. The NHS is now integrating mental health care into primary care services, ensuring that GPS are equipped to address both the mental and physical well-being of seniors. This holistic approach is long overdue. Addressing mental health is not just a box to check, it's a fundamental aspect of providing comprehensive care for seniors. The fact that many elderly individuals suffer in silence, largely due to the stigma around mental health in later life, makes this reform all the more critical. Yet, while the reforms may seem promising, they must be backed up with concrete action. The government is rightly committing substantial resources to hiring more GPS, practice nurses, and healthcare staff to manage demand. But without adequate investment in infrastructure, particularly in underserved areas where GP practices are outdated and poorly equipped, the reforms will fall short. There is a glaring need for upgrades to GP surgeries, including accessibility improvements such as wheelchair ramps and better parking. Physical barriers to healthcare are not just an inconvenience, they are a direct barrier to the well-being of seniors. Finally, these reforms will only succeed if they are implemented with a laser focus on ensuring that no senior is left behind. The government's support systems, digital literacy training, community outreach programs, and helplines are essential to making sure that the elderly population can navigate these changes and take full advantage of the improvements on offer. The reality is that many seniors will need assistance in learning how to book appointments online or in accessing new digital systems. Failure to provide this support will risk alienating the very people these reforms aim to help. There is no time to waste. The government must ensure that these reforms are not just well-intended policies on paper but lived realities for the millions of elderly people relying on them. If the UK is to meet the challenge of an aging population, it must invest in healthcare that is responsive, accessible, and tailored to the unique needs of seniors. These reforms are a step in the right direction, but they must be fully realized if they are to deliver on their promise. The future of our seniors, and the future of the NHS itself, depends on it.